Hello, everyone, and thank you for joining us today on our healthcare webinar. My name is Ken Wells. I'm with the Washington Hospitality Association in the Business Development Department, where we support our industry in health insurance. Joining me today is Holly Hahn, President of CLG Employer Resources. She's our managing broker of the Hospitality Trust and our broker partner. And also with me today is Selena Davis and Cooper Biddiscombe with Kaiser Permanente. So thank you guys for joining us.
Thanks, Ken.
A couple of things, the statement or our mission kind of today is really, we're getting a lot of questions about healthcare in the aspects of how COVID-19 is affecting aspects in payment eligibility, coverage of COVID-19, employee mandatory testing. We're getting a lot of questions about that. Adjusting your policy, and some of the new things that are coming up are telemedicine. So those are the things that we're going to cover today. If anything that we don't cover today, feel free to ask questions. Afterwards, you'll be able to add additional questions. So we'll provide additional information to you if there's a section we're not able to cover in today's webinar. First, let's talk about payments and eligibility. There's been a lot of questions about that right up front. Holly, given we're into this now 4 or 5 weeks, and this obviously this horrible situation, can you give us an overview of what the employers need to know regarding payments and employee eligibility?
Sure. Yeah. So with insurance, what you have to remember is that it's prepaid. So, you're paying now in April, the end of April, for what's going to be coverage in May. Typically, the insurance companies have a 30-day grace period for you to get you some time to get that payment in, depending on your cash flow. And then our insurance commissioner, with what's going on, extended that an additional 30 days. So most policies should have a 60-day grace period. Our high hitter Hospitality Trust and Kaiser has extended that to 90 days. And then I also would encourage you that if you've got a self-funded plan, the DOL still requires 30-day claims payments, but you might be able to extend some of those fixed costs, but that would be working it out with your carrier. But if you're a fully insured product, you've got typically 60 days in which to pay that premium. So you've got a little bit more grace with it. What I want to make sure employers are aware of is that premium or that payment is still due. And if for some reason you're unable to pay it at the end of 60 days or the end of 90 days, that coverage will be retroactively terminated to the last day that you paid. So if you're 90 days past due, you get yourself terminated, that means those employees lose that coverage back 90 days. So it could be back to February 1st or January 1st, depending on when you last made that premium payment. That then creates problems for the employees and yourself, because you may have collected premiums from employees that you then have to refund the payroll deductions that you've done to the employees. And then those employees are without coverage. So they may be billed for services that they had during those times where they thought they had it and they got a prescription or they went and had care or even had a surgery or something. Those will all be turned around and billed to the individual by the insurance company or the provider that they have seen. And then the last issue that it causes is that individual now doesn't have coverage and is left scrambling to figure out going and researching an individual health insurance plan. Because if your employer plan is retroactively terminated 90 days, there won't be any kind of continuation or COBRA available to you. So that can cause some problems with payment. So you want to make sure you know what's allowed in your contract and stay on top of that.
Okay, so question on payments here real quick. So 60 days or 90 days, right? Whatever my plan allows is extension. And let's say for here, if you're on the high hit plan, it says 90 days. In 90 days, so I got to pay back that whole 90 days, or can I start, how does that work as far as me making payments? Because 90 days, I'm not going to have the money to pay all that.
Right, good question. So you just need to make sure that you don't go any further than 90 days. So you would need to make sure you pay by May 1st, you need to make sure you pay that February payment so that when you go into May that you are only 90 days
Right.
past due at any given time and that you haven't gone further than that.
Okay. But for clarity for everyone out there, if you're not on a high hit plan, that might be 60 days. So,
Right.
really make sure you understand. So if you're 60 days out now, so 60 days from now, I can still stay on my 30-day plan, right?
Mm-hmm.
By the end of the year, by the end of my term, I've got to have this thing paid, or am I still allowed another 60 days at the end of the year? Because obviously at some point I'm going to have to pay back, right?
Yeah.
And okay, go ahead.
Yeah, that's a good question. We will have to see how long this goes on because typically when you come up into renewal, you need to have your policy paid in full in order for the carrier to renew your contract and put you into a new contract year. So that will be something that may need to be addressed or come up at renewal time, what happens with these employers that may be past due.
Okay, so if I'm 6 months out, I might be wanting you to make some payments along the way
Yeah.
to catch up, so I'm covered up that extra 60 days that I kind of extended this.
Yeah.
Okay, great.
And insurance companies have been as flexible as possible, and the OIC stepped in and added the extra 30 days. But we have to keep in mind it's prepaid insurance. If insurance companies are doing special allowances for certain employers, they're setting precedents for all. And so while they want to be helpful, you've got to stay up to date on your payments or at least keep within those guidelines of the 60, 90 days.
Okay. And then what about the eligibility side of this? I mean, obviously there's a lot of changes going on out there. I've just put some employees on furlough or standby or whatever you want to call it, right?
Right.
Can you talk about that?
Yep, there's all that terminology. So first off, if you are a large employer that's self-funded, you're going to want to check your plan language or plan document, or even add language for a furlough or a standby employee so that works best for your company. But if you're a fully insured employer, what's happening or what the insurance companies are allowing is that those employers can take advantage of the 90-day leave of absence provision that's within the policy and allow that employee to have either reduced hours or no hours during that 90-day leave of absence time.
Okay.
So they're being as flexible as possible to help that employer maintain that coverage for that employee. That's if the employer is able to pay for the employee's coverage. So if you're a business that's completely shut down and you don't have any funds coming in, how are you going to pay for that employee's insurance? At that time, you would then want to terminate the employee, and that employee would either, depending on your size, be offered state continuation or COBRA coverage. It also opens up their window to go into the individual marketplace and see about getting coverage through there that may be subsidized or an individual premium for them.
So
go ahead.
So I got myself on this PPP loan, right? I got some employees. I'm looking at bringing them back. I extended my payment 60 days, right? All of a sudden, 60 days from now, I find out that I can't pay my insurance. And then now we're looking back. Now, I know I'm putting everybody on the spot here, but I mean, now what happens? I mean, because I've not been able to pay it but I've extended it for 60 days and everybody thinks they're on health insurance.
Right. Yeah, that's a problem. That's what I was talking about a little bit earlier, is that coverage, if you go past that 60 days and get yourself terminated, then the coverage is going to retroactively be terminated for that individual back the 60 days, and there isn't going to be a plan for them to potentially COBRA or continue on. So they will need to go to the individual marketplace, which they will need to apply for coverage retroactively back 60 days if they're wanting to keep it maintained and in place. So it can
this
cause
sounds
some
like
problems.
I have to make some decisions. Sounds like I need to make some decisions up front, because if not, I could have some liability issues.
Right. And the other thing, I've mentioned it, but just want to make it clear, is that if you lay off all of your employees and you don't have any active participants on your plan, you need to check with your insurance carrier, because there may not be a policy in place. They may have to suspend your policy, and there wouldn't be a COBRA, a plan of which to offer COBRA. In our hospitality trust, we're allowing employers to keep that empty plan or that shell in place until they hire the employees back. But not every insurance company is doing it that way. And so some of them, they've got to at least have one active participant in order in order for there to maintain a plan and to be able to COBRA a plan. So you'll want to make sure that you reach out into your insurance agent or insurance company and verify that.
Okay. And keep in mind here, if you're online here, and this, because there's a lot of information, and unless you're dealing with healthcare every day, you might not be grasping all of this. And for any reason you don't, come back and ask these questions. I mean, we'll get you the information and consulting that you need. Let's move on. Let's talk anything else we want to cover in payments and eligibility before we move on to COVID-19 treatment.
Not from me.
Okay. So coverage of COVID-19 treatment. My Kaiser friends here, what can a covered member or someone in the industry expect to be covered for testing and treatment?
Hi, Ken. I'll go ahead and take that question for you. So for medically necessary screening, testing and treatment for COVID-19, and that includes visits, associated lab testing, emergency, urgent cares, we'll have associated cost shares to zero, no cost. So there will be no cost or no cost to the member. Currently, this includes claims through the window of April 1st through May 31st, and this could extend depending on how this outbreak continues.
Okay, so I'm covered.
You're covered, correct.
I'm covered, and I'm covered for any treatment as well.
Covered for any COVID-related treatment that's mandated by a doctor or recommended by a doctor, and this is regardless of your plan type.
Okay. So what if I'm on a high deductible or an HSA?
Yeah, so even if you're on a high deductible or HSA plan, regardless of your plan type, like I said, there will be no cost shares associated with any COVID-19 testing or treatment so long as it's ordered by a doctor.
So what if my employer is self-funded?
Self-funded is going to be, self-funded had to opt into this, I believe. Cooper, you may be able to elaborate a little bit more about this, but the self-funded groups, I believe, had the option of opting into the COVID-19 treatment plans to cover the COVID-19. And the self-funded groups I'm managing have been opting in, but I believe it's up to them. Cooper, do you know a little bit more about that?
Yeah, that's actually a great question and a wonderful clarification. For the fully insured plans, regardless of your carrier, there is going to be some COVID-19 coverage that would have no cost shares for the member. So it is important to check with your individual carrier. For Kaiser Permanente, we have decided, following the implementation of new ICD coding, for us to easily track COVID-19, and that is across the market, regardless of which carrier you're in. That went into effect April 1st. So right now, our Kaiser plan is to do April 1st through May 31st, with an option of extending that later, depending on how things run out. But I'd encourage you to check with your specific carrier, because there is some latitude within each carrier to adjust their dates as they see fit.
And self-funded plans did get to opt in or opt out of that. And like you said, Selena, most of my clients, all of my clients have opted in on having that coverage, but you would want to check with your carrier, check with your plan, check with your employer before you're making that assumption.
Right. And if you're self-funded, making sure that you communicate that out to your employees as well.
Right.
Anything else we want to cover on COVID-19 treatment? I think I have a question here. Let me see if I can get that real quick. Okay, so next we're going to go into testing. Well, let's kind of stop and pause and have that here. What testing options are available currently to test if I have or have had COVID-19? What are those options?
Looks like I'll take that one. So for the COVID-19 testing, as of now, testing isn't super widely available. So we are only doing testing to those that require it and that are medically necessary. For Kaiser Permanente specifically, which I'd imagine most other carriers, we're following the CDC guidelines on when that testing is required. And sorry, I actually was reading the question in the chat box. As a Kaiser Permanente member, am I able to have lab work, physical and orthopedic checkups? So that's a good question specific to Kaiser. So for Kaiser, we actually have maintained 8, Kaiser Permanente Washington, we've maintained 8 of our multi-specialty locations open, and we've moved all services that can be telemedicine to telemedicine, but we still are allowing in-person office visits. Those just have to be pre-arranged, and there is some protocols that we're following based on the CDC guidelines.
Okay. All right. And then did you really cover testing options? I mean, does anyone, there's antibody testing options, or what are the options out there?
Yeah. So right now, the most widely available testing is currently not antibody testing. For Kaiser Permanente Washington, we're currently contracting. There are some out there in the United States, but I would say it's not the more widely available testing. Right now, it's still on-site testing within certain locations. Kaiser Permanente went live with ours this past weekend, but there was locations like University of Washington that have been testing for longer. And currently they're only testing for active COVID-19 antibodies, or I'm sorry, COVID-19 in the system rather than the antibodies. So what I'm interested to see is kind of post COVID-19, once testing is more widely available, if it's going to be something that maybe we'll all have access to. Right now, nationwide, it is, of course, kind of being rationed just for those that really need it and that need to be confirmed if they are, currently have COVID-19 or the coronavirus.
Okay. And then let's talk about, Pandora's box here as we open up, right? COVID-19 employee testing. The country is going to open up here, and we're going to start taking it piece by piece, state by state. Obviously, hopefully Washington will have some plan in May. We're yet to see that. So what's expected? What are you guys seeing in the health industry on getting employees back to work? How do you guys see this?
Yeah, so I can take a first stab at that. I think we're all kind of speculating and expecting it's not going to be a light switch, as I think we heard on some of the information we got from the state. It's going to be kind of a step process. So what I could see happening is loosening up of some of the regulations or guidelines around social distancing, or maybe opening up certain companies. I think the hardest thing will be is that since wide-scale testing is not available currently in the state, we're only testing those that really need to be and that are medically necessary. So for companies, maybe at some point to allow their employees to come back, and they're asking for them to get tested. Right now, I don't think the market can really accommodate that. And I know within Kaiser Permanente, we're following the CDC guidelines, which means that we're saving those testings for those who medically necessarily need it.
Right.
So as an employer, if I am opening back up and I'm wanting to reassure the public that my employees are, healthy, it's safe to come in, and I want, let's say testing's available, let's say antibody testing's available, and I can get that for my employees, what I will want to consider is the cost to do that, because if it's not medically necessary, if I'm a healthy individual coming to work and you as the employer are just wanting to reassure your clients that this individual is healthy and safe, it might be at your cost, because the insurance companies may not be covering it, because what you're hearing Cooper and Kaiser say is that if it's got to be the CDC guidelines, it's got to be medically necessary, you've got to be having some symptoms in order for that testing to be covered. Now that could change if our state or our government says it's mandatory for restaurant workers or hotel workers to come back and have their temperature taken and have had the antibody test or some kind of a test. That changes the coverage in the insurance. But if, as we're opening slowly and you're wanting your employees to return to work, and you're wanting even your employees to feel comfortable about returning to work and having testing done, it might be at the employer's cost, because insurance companies may not be covering it in the beginning.
Correct. And it'll probably go essential employees first, right? And then those first waves that are allowed to come back, et cetera, because there's definitely going to be some limitations. And we're seeing that from some of those that are communicating antibody testing, capabilities moving forward of how that might roll out in the industry. But definitely this will be an issue that will be addressed on from a state and federal level first. Adjusting your policy. Let's move from COVID-19 employee testing. I think we're all going to have to watch that over the next 2 to 4 weeks. We know that this is going to be an ongoing topic. And as those topics unveil themselves for the industry, we'll definitely have information on our hub, which is the hub.wahospitality.org. So we'll continue to provide information as soon as it's put out on our hub to our industry folks. But let's move to adjusting your policy. I mean, obviously, things have changed, right? Number of employees, sales, et cetera, and everybody's, I'm sure, thinking about, they've got to either reduce cost and/or, they're going to have employees change. So, what are the steps that can be that really the members should be taking now as it relates to the current policy and reducing their premium cost?
Right. So most employers, to start with reducing their premium, it was just the layoff of employees or the reduction in hours employees are working in, so they're no longer on the health insurance plan. That right there decreases your policy cost. But as we're opening back up, or employers are looking at, okay, I have this plan, it costs me X, what can I do? The insurance companies are being accommodating to allow employers to buy down to a lower cost alternative plan. And it depends on the carrier. But for example, our hospitality trust, we're allowing an employer, if you were to contact me today and say, hey, I need to look at other plan options, we'd take a look at the rates that were available to you at renewal in January. You could pick a different plan and you could start on that new plan, May 1st. And you would be on that plan until the renewal time at January 1. There are other carriers that are doing special underwriting considerations to take a look at the population of the group right now, today, April 22nd, and then allowing you to make a policy change that would be effective, let's say May 1st, of which then you would stay on that contract for 12 months. So you're resetting your clock, or you're resetting your calendar. What you need to keep in mind is that when you reset it, that then changes or makes there be new deductible, out-of-pocket, copay amounts that impact that individual at that time. So if you are on a $1,000 deductible right now and you change to a $5,000 deductible plan May 1st, that coverage, your premium will reduce, but that coverage also resets for that employee starting May 1st, and they'll have additional deductible to meet starting right then in May. Okay.
So I can make adjustments now?
You can make adjustments now. It depends on the carrier. So reach out to your agent or reach out to your carrier and inquire, what that would look like for you.
And I can also potentially reset going forward. So can I reset now on a temporary basis, and then let's say July 1, maybe reevaluate it again for the next 12 months?
Typically not with your same carrier, but you could potentially reevaluate and maybe move to a different carrier if you were wanting to do that. If that was, if there was something more cost effective out there for you with a different insurance company.
Okay. Let's talk about other types of coverages. What do members need to know about getting care for other types of illnesses?
So what we're seeing is that I think what you're leading into is telemedicine, is getting care that way.
That's becoming hot right now.
Yeah, it is one of my favorite products. I mean, don't get me wrong, health insurance is important. You need it. But myself, busy working while I'm at home all the time now, but I've got 3 kids, and what do I do if somebody needs care? I have telemedicine benefits within my health insurance plan, but then I also have Teladoc, and that gets me access to a provider, US board certified provider, 24 hours a day, 7 days a week, and it can be for myself and anybody in my family. I've got the app on my phone, bring up the app, click that I need to talk to a physician, type in why, and a physician gives me a call back. Usually I've had it happen in about 30 minutes. They give me a call back, and then it's as if you're sitting in front of them in the office. They're asking you those same types of questions. You can do a video call. You could send a picture of, let's say it was a rash or something you had going on. And so I love it, is that it is getting that individual that first step in care that most people are needing. So if you're on a high deductible plan or you don't have health insurance, these telemedicine policies that are inexpensive, a couple dollars a person a month, up to $10 a month a person, depending on what you're purchasing, you can get access to a provider that can then prescribe medication and help you out with whatever it is that's going on with you.
Okay. let me take a step back because a question came up on just current adjustments and things like that. Can I take my college kid off the plan and put them on an individual plan and save some money today?
You should be able to with Section 125 plans where your premiums are taken out of your check before taxes. There needs to be a qualifying event. So I would say check with your insurance company, check with your employer on the plan. But you may be able to remove those children from your plan and purchase an individual plan and take a look at what the cost difference would be on that.
Okay.
Yes.
And so if I put an employee on standby, do I need to leave them on the plan, take them off the plan? How does that work on the standby thing? And I'm sorry, these are just questions that come up. And so I want to make sure we really cover that.
Right. So if you are an employer that is able to pay for that individual and you've put them on standby, then yes, leave them on your plan.
Okay.
But if you are an employer and you cannot afford to pay for that individual, then that's where you would want to remove them from the plan and they would be offered COBRA or continuation or could go look for an individual plan.
Okay. And, so the worst case scenario, I put them on standby. I want to reopen. I can't reopen. Our business is closed. What happens with COBRA?
So it depends on the carrier.
Okay.
Some of the carriers you need to make sure you have an active participant on the plan in order for the plan to remain active. Our hospitality trust is allowing us to go down to no active members and still offer COBRA to the individuals that have been, removed from the plan. And then that also lets the person look at individual coverage.
Okay. So what happens next? Let's cover that. So what do members need to know and to be thinking about as the shelter in place gets lifted or extended? Discuss coverage after the 90 days leave of absence.
Yeah. So what people need to be thinking about or talking to their insurance agents, talking to their insurance carriers is that if I've used this, 90-day leave of absence, what happens if this goes longer than 90 days? If I'm out of work longer than 90 days, because my hours could have been reduced in March, or maybe I came off the plan April 1, and I'm not going to be back full time until, June, July, past what would be the 90-day leave of absence. So you need to talk to your carrier and see if then that means they need to be removed from the plan and offered COBRA, or if in the instance of our hospitality trust, our contract doesn't specify 90 days. And so we're allowing it to be at the employer's discretion. If somebody comes back after 120 days and they want to be added back to the plan as an active individual, the employer can do that. And that employee doesn't have to resatisfy a waiting period, picks back up where they were with deductibles, out of pockets, and their benefits at that time.
So they can leave the plan and end up coming back off the plan during this, obviously just specifically, during this COVID issue, but that's not for all carriers out there, correct?
Right. That's why they want to check with their carriers, because a lot of carriers have that 90-day specific language in their contract. And so going over the 90 days, that's where then you need to look at, is it COBRA, is it state continuation? What happens after that? Is there any other provisions in the plan? Will we see changes made? Those things I can't answer, but I can tell you that it's at least a 90-day, and our hospitality trust is allowing it to be at the employer discretion and can extend past 90 days. Okay.
I've got to peel back a little bit. This is just a kind of a thought, right? If I'm an employer and I'm having to reduce cost, I'm not, hospitalization plans are obviously where I want my employees to be. But at the end of the day, let's say I'm really, having to re-enter and rethink this whole thing. So some things that I think about, and I'm just, from those that are really having to take a peel back is those fallback positions might be lesser plans, maybe not hospitalization plans right now. I know that's not going to make my Kaiser friends happy here, but at the end of the day, right, I might have to have medicine or a combination of something like telemedicine and an employee assistance plan and life insurance, or an RX card, pharmacy cards. And an interesting thing was I added that up to the plans that we offer. And that little package right there is like under $6,
Right.
you know? And I thought, gosh, if I didn't have hospitalization, at least I have something that I can provide my employees and support them and help them. So, and wellness plans as well. So anyhow, I just wanted to bring that up because I know that that's, you know, everybody's kind of thinking about what decisions they're going to make moving forward. And I'm really glad to hear that our relationship with Kaiser here, Kaiser Permanente, is that, you know, you guys are really able to do everything you can to help our members out in the aspect of making sure they're getting proper treatment with COVID, you know, 19, that it's covered, that you're extending the plan, you know, in payments, you know, further than the insurance commissioner requires, and really allowing the members to adjust their policy. So I'll tell you, I'm impressed with that aspect, and thank you very much. I hope all carriers out there respond like you guys do to support the people in the industry. Have I missed anything? Is there something here I should have asked that you're getting questions on that we haven't covered?
The one thing that I would say is that, or a question I would ask is, if I need care today, what should I do? What does Kaiser recommend I should do? I'm not feeling well. What do I do?
Certainly, we're trying to keep as many people out of lobbies, waiting rooms, doctors' offices as possible, just to reduce the possibility of transmission. So I would encourage anybody that needs care today to first check to see what virtual care options their carrier may have available to them. Like we talked about earlier, just about every carrier out there is offering some sort of teledoc or telemedicine option. At Kaiser, we have a care chat function that you can get a message onto your phone. You can email your doctor. We also have a consulting nurse line that's available 24 hours a day. I would encourage folks that need help or need care now to check in with those resources first and see where they direct you to go. If they can solve your problem at a lower level and keep you out of the doctor's office, that reduces risk all the way around. And there are some amazing options that's available now through telemedicine. Like we said, it's really having a moment right now, and people are really starting to just grasp how powerful it can be. So if you haven't tried it, I would definitely encourage folks to try their carrier's telehealth options.
Okay.
So I shouldn't be avoiding getting care or thinking I can't go someplace if I'm not feeling well. I should check with my insurance plan.
Call Holly.
Yeah. Yeah, I'm not a doctor. I'm not a doctor.
We're not doctors.
But I can help you get a telemedicine plan. Right. And we have had several employers that have reached out just in the last week and are setting up telemedicine plans because they haven't been able to do a health insurance plan and have the full medical, but they want to do something. So.
Okay, I have one more question here. It's a college kid question again. Actually, now two questions. They're starting to pop up. So college kids apply for their own coverage and have no job, which is typical of college kids, right? We all want them to get a job. And they're will they be offered subsidized coverage? And what if the college student is out of state?
So that's going to depend on it's going to depend on the individual and if they're claimed as a dependent on your taxes or they're filing their own taxes. And then it's going to depend on the state, whether it's a state health exchange like we have in Washington or it's the federal exchange as to how they apply. But going through that application process, our state opened up our open enrollment that had closed for individuals that had that are uninsured at this time to be able to go into the individual marketplace and take a look at plans. So you don't have to have lost your job like we're talking about or have had reduced hours to do it. You can go on right now to the Washington Health Plan Finder and take a look at that. And the subsidies are based on your income. And so you do want to keep in mind that it does impact what you're getting through unemployment as an income, and unemployment was just increased. So we have some people that may have made a purchasing decision based on what their income was and what they were getting on unemployment, only to have had that increased. And so they may need to go back into their health plan finder account and make some changes and make sure that that's accurate and up to date.
What I'm asking, and that date's May 8th, right?
That we have individual plans that are, you can go into the marketplace right now and apply. Yes.
Okay. All right. So, okay. But it doesn't close. The state open enrollment doesn't close on May 8th then.
No, it does. It does.
Okay.
Yep.
Okay.
That's just a special open enrollment provision right now.
Okay.
But if in if in May you end up losing your job or have your hours reduced because this has gone on longer and your employer can no longer afford to pay for your coverage, or maybe they covered you for April but they can't for May, that's going to be an event that's going to allow you to go into the individual marketplace regardless of whether or not the open enrollment is going on.
Okay, got it. That's specific to COVID and those people. Okay.
Mhm.
That's it for questions. Holly, thank you very much. Selena, Cooper, you guys, really appreciate you guys doing this. There will be a webcast on thehub.wahospitality.org. Feel free you can ask questions after and we'll get back to you as well. So thank you all for attending and being part of the webinar. And Holly and Selena and Cooper, thank you very much for your time.
Thanks for having us.
Okay, everyone have a great day and be safe.
You too.
Okay, bye-bye.